Hello, and thank you for joining me today. My name is Raj. I'm the care manager for the Bromley branch of the Home Care Preferred. We're an award-winning domiciliary care company that provides support for health and social care needs of adults over the age of 18. If you care for a loved one, a family member or a friend, or even yourself, here are 10 tips that you could use to help yourself put together a better way of managing medication. First of all, gather all the medication, vitamins, over-the-counter medication and supplements and keep them in one location. This will ensure that they're easy to get to. Number two, make sure medication is stored properly. Does it need to be kept in a cool, dry place? Should it be stored out of reach? Is it a controlled drug? These are some of the things you may want to think about when storing your medication. Number three, create and maintain an up-to-date medication list. If needed, this can be used when visiting a healthcare professional. I would suggest always take it along to a GP surgery visit or whenever you're meeting any healthcare professional. Number four would be to pre-sort your medication for the week. That way you'll know how much of each medication you have, and when it comes to administering it, there won't be any mix-ups. Number five, double check the labels for all medication. Ensure that there's no negative drug interaction. Sometimes a lot of drugs can be taken together a lot of the time. What you want to make sure is that they don't collide with each other, causing any adverse reaction. Number six, make sure the medication instructions are clearly printed on the label. Sometimes when they're handwritten, they can be a little bit difficult to understand. And if you're finding it difficult to understand, please go and speak to the person who prescribed the medication for clarity on this. Number seven is to set up a medication reminder and a tracking system. This can be as simple as reminders on your phone, or it can be a written system. We call it a MAR chart, but you can have a simple notebook with handwritten notes into when to take the medication. Number eight would be to understand the possible side effects of medications. This would be in terms of awareness and alertness, issues in terms of breakouts with skin conditions, and the effect that each medication can have whilst interacting with another medication. If you have any concerns with this, seek advice from a medical practitioner. Number nine would be to set up a system to help people with types of dementia, including Alzheimer's disease. This would be with their medication, and things you need to take into account would be communication and reminders to take medication on time. Finally, I would plan ahead for all medication refills. What you don't want is to get to the end of your bottle and realise that you need medication that isn't there. That's my 10 tips for clear medication management. I'm holding a forum next week. The details are listed below. Please feel free to drop me an email so that I can send you an invite where you'll be able to join other carers and be supported by professionals to discuss the needs of medication, at home especially. We may also be answering questions such as, what does as needed mean? When should certain medications be stopped? And what should you do if you've missed a medication? Thank you for joining me, and I look forward to seeing you at the forum. Thank you.